Hey guys, my name's Joe. If you are watching this, you already know me. I'm a second-year emergency medicine resident doctor in the Philadelphia area. I kind of wanted to start a informal video series to kind of document what's been going on with the coronavirus pandemic, more for myself, more so that in the future I can look back and see the daily updates and see how things unfold. But a lot of people have been asking me questions about it, a lot of family members, friends, and I thought this might help people too with information and keeping updated. If this is helpful, let me know, and I can hopefully keep doing this if I'm not too busy. If not, I'll just stop, and maybe this will be helpful, but we'll see. Again, this is a very dynamic topic. You guys have seen it all in the news. I'm sure you guys are sick of it, but things are changing every day, every hour. So whatever I say here is probably going to be outdated within 24 hours. But everything I say here is also of my own opinion. It's based on what I see every day in the ER. It's based on my own research as well. If you have any questions, let me know. I can try to update and try to keep everyone as informed as much as possible. But again, things are very fluid right now. So I just wanted to talk about the updates of what's been happening for the past couple days and kind of document all that. So today, March 24th, it's been 11 days since this was declared a national emergency in the United States. And cases are now at 46,548 by the time of this recording. It's a ton of people, number 3 in the world for this. And, it's steadily rising as well. You guys are in self-isolation. Most states are. You guys know that the National Guard is being deployed to New York, California, and Washington. It was, I believe, yesterday that was sent out. But the main issues, PPE. Personal protective equipment. This is probably the number one issue rising in the healthcare industry right now, and it's dire. It's only been a couple weeks, and we are already at low levels of protective masks, gowns, goggles, what have you, and it's tough. Some hospitals have already gone the way of giving one paper mask, not even an N95, but one paper mask to every single provider or healthcare worker that is to be used per week. And if you can imagine that's tough. Not only physically in wearing it for a whole week for one person, but that's just a testament to how dire the situation is and how low the reserves are. The CDC and Pennsylvania Department of Health just gave out a report to local ERs that we should all be wearing one mask per shift, not touching it, not moving it, and then removing it at the end of the day. And this is, this just shows how little supplies we have. Legitimately, there's also a guideline in there that's calling for providers, doctors, nurses to be prepared to use homemade masks when, not if, but when we run out of N95s and paper masks. And this includes scarves, and this includes bandanas. If that doesn't, tell you how tough the situation is, or the inevitability of having to go to that, it's tough. But N95s are very needed. I can't stress it enough. If our doctors, nurses, EMS personnel cannot have these and be adequately protected, eventually we're going to run out of healthcare workers for you guys. We're going to run out. Everyone's going to be in quarantine, and we're going to get sick. It's just an inconvenient truth. Moving on, medication-wise, there's two big topics here. So ibuprofen, a huge controversy about it in terms of the public knowledge. This all started out with the French Prime Minister of Health. I believe he tweeted talking about how there have been some cases of people getting worse after giving ibuprofen for fever, pain, etc. This has not been rooted out in data. This has not shown it's not grounded at all. The WHO still continues to say, and I'll put up a graphic, that they do not recommend against it. There's no data supporting that claim. Maybe we are thinking of using Tylenol first because of that, but again, it's not rooted in data. If you're using it and you have mild symptoms, there should not be any reason to believe that it's going to worsen your symptoms or worsen your case. Second of all, anti-malarial medications have been touted by the public as our cure-all. This is what we're going to use. This is our cure to the fight. Hydroxychloroquine and chloroquine mainly. Now, we cannot use these medications on everyone, and it's not because of supply. It's plentiful. It's more because we just can't. These are old medications. These are not benign medications whatsoever. These aren't safe for everyone. They have pretty severe side effects, and medical professionals need to kind of weigh the pros and cons for every patient. It's a case by case patient or basis. We're talking about possible side effects of life-threatening arrhythmias. We're talking about agranulocytosis, and this is a big word that means that you may not be pushing out or producing the amount of red and white blood cells to fight off infection. And this is a side effect that can be caused by hydroxychloroquine and chloroquine. There's been a report of someone drinking fish tank cleaner, which has a main ingredient of chloroquine phosphate in order to try to protect themselves from the coronavirus. That guy died, and his wife is in critical care right now. These are times when you cannot take things into your own hands and try to, just loosely take medical information and take it upon yourself. There are side effects to these things and possibly death. So again, we can't tout this as the number one medication that we need for everyone. We are only using it for severe cases, and I think the public should know that it's not a cure-all, and it's, again, not completely safe or a for everyone drug. Talking about testing, the FDA approved a 45-minute test that is still being rolled out. It's by a private company, so not all hospitals have it. In fact, I don't know any hospital that has it. Right now, they're still trying to sort out the data on it, whether it's specific or sensitive. Our current test that we test people with is only 74% sensitive, and unfortunately what that means to the public is that there's a 26% false negative rate, and that's why we tell people to still self-quarantine when we test them, when we don't have results back, and even if it's negative based on your symptoms. We have to treat both the test and the patient based on their clinical appearance, so we have to think about that. In Philadelphia, there's a new testing site available at the Citizens Bank Park. This is also not for everyone. There's only 2,500 tests that were available at that time 3 days ago on their first day. Again, not for everyone, not for people with mild symptoms, and the criteria was for older people with symptoms or healthcare workers with symptoms or a known exposure. So again, don't just hop in your car, drive down there and expect to be tested, and don't do the same for hospitals. You must call ahead, see what their testing criteria is, and see if we have enough tests. I can tell you for the next week, 2 weeks, we just won't have it, and I have sent multiple people home just to self-quarantine without a test. These are times when we must ration what we have to those that it will benefit the most. And for those with mild symptoms, 80% of you guys with mild symptoms, or those who come in with those, are going to be completely fine. So it's up to our determination to see if it's necessary or not. Our hospital system and multiple other hospital systems I know have been rolling out outdoor testing facilities outside the hospital. Make sure, again, you call ahead, make sure you see who it's available to, and see how many tests that they have. And finally, I just kind of wanted to document for everyone what I've been seeing in the ER, in the front lines, and what the feelings are. I've only been a resident for 2 years, but it's eerie. It's weird. It's unprecedented. And I think my sentiments are echoed by other people who have been in the business way longer. Total numbers in the ER are down, which is great. That's limiting exposure, and people are treating it only for true emergencies, for the most part. But it's weird. Every time a patient comes in, we have to see them at the door. We have to ask them the questioning for coronavirus. We have to take their temperature before they're cleared to come into the ER. And if they are positive for any of those criteria, they are treated as a positive coronavirus patient until proven otherwise, and until they're either discharged or brought into the hospital. Unfortunately, there are sick people. It's rare for younger people to have severe illnesses or to have any illness whatsoever, but it's we've seen it. We've seen sick people. We've had unfortunate conversations with family members, and we've seen people that need to be intubated and are on life support, and it's only going to get worse. I can't stress that enough. It's time to practice the honor code. It's time to practice, and using our best judgment. Do not come into the hospital if you're having mild symptoms, and stay home. We are trying our best to get people in and out as fast as possible to limit exposure, and most of the time people are understanding of that, so that's great. But overall, on the positive side of things, people have also been awesome. People are supportive of us. People are supportive of police, EMS. They've been sending in food. They've been sending in cards of appreciation. And it's been great. We hear you, we appreciate it, and we'll continue to fight here for you guys, and try to figure out the best way to circumvent this problem and this epidemic. How can you guys help? How can citizens help? Keep donating masks if you have them. That would be huge. Support your police, EMS, your healthcare workers, those who are still out there, cooking for, the world, and people who can't, stay home in quarantine, that are essential personnel. Support them as much as you can. At this time, it's a critical low level at the blood bank as well. I believe the American Red Cross is still accepting donors. People still get sick from regular stuff. People still get hurt. People will still need blood transfusions. So please, if you have time, and I know you do, if you have time and are able to do so, if you can donate blood, that would be humongous. Otherwise, stay home. I'll try to update everyone as best as I can of what I'm seeing personally and what my friends are seeing, and we'll continue to fight, and we'll see you guys out on the other side. Again, any other questions, let me know. If you find this helpful, let me know, and I'll see what I can keep doing for you guys. Stay safe.